The CDC releasing new information and statistics about the rate of autism in children in the United States. And from that report, the numbers appear to be increasing with time. Our Caleb Yager looked into this, and he actually had the chance. Caleb, you went to the Barber National Institute right in Erie, which really helps a lot of families that have autistic children in our area. And you talked to somebody who knows front and center all about these statistics. What did she have to say?
Yes, absolutely, Eva. Good evening. This institute is committed to helping those on the autism spectrum find care, education, and a bright future. After looking at the recent reports from the CDC, their reaction was the outreach. It has to keep expanding.
In the year 2000, 1 in 150 children had been diagnosed with autism. That proportion as of 2020 has increased to 1 in 36.
It manifests itself in a number of ways. One of them is the presence of many repetitive behaviors. Another behavior that one might see was the lack of eye contact.
Executive Vice President Dr. Maureen Barber has a child that was diagnosed with autism at a young age. She also writes a weekly blog about autism and makes it her duty to be well informed about the disorder.
So we are identifying children at perhaps 2.5 or 3, when it used to be that the children did not get identified until they went to kindergarten. And I think just as important is the fact that we as a community, we as parents, are much, much more informed about autism.
For the first time, diagnoses were more common among Asian, Black, and Hispanic children than it was amongst Caucasian children.
We know that the earlier the diagnosis, the child can then begin to receive services and resources and supports that the child does significantly need.
But she believes it can still get better and more accessibility to services is necessary.
We know about autism. It's in our backyard, and we need to continue to make the availability of screenings for children, especially in those rural areas that there may be limited physicians or developmental psychologists who are able to do the screenings.
Dr. Carey and I talked about her experience with raising a child on the spectrum, and that's exactly what it is. Autism isn't just one thing. The spectrum can be a range of all different kinds. It can go in different directions all the time. If you're interested in seeing Dr. Carey's work or finding out more information about the Barber National Institute, links will be easily accessible on our website at erienewsnow.com. Reporting live from the studio, Caleb Yager, Erie News Now.